we're going to go ahead and get started. I want to welcome everyone to the Color of COVID, a webinar series brought to you by the Institute for Healing Justice and Equity. Next slide. So today's webinar is entitled Healing Justice Approaches to Community and Self-Care. And I want to talk a little bit about healing justice. So named by Kara Page and the Kindred Southern Healing Justice Collective, healing justice is a framework that visions how we holistically respond to and intervene upon generational trauma. And it involves practices that transform the consequences of oppression, the consequences that it has on our bodies, our hearts, and our minds. And it's a framework that has guided the work of folks for years, but in this moment of crisis, the values can help guide us and help us know when we need to push, when we need to stabilize and resource ourselves. So it's an approach that is community focused, meaning it centers those most impacted by systems of oppression and doesn't privilege the academy over lived experience. It's also collective, meaning that there are individual practices, but the work isn't individualistic in nature. Healing justice is also interdisciplinary. So no one discipline or perspective owns this work, which is why we were intentional about making sure today's panel reflected the intersectionality, and why I'm really excited to have this esteemed panel of engaged practitioners, activists, and scholars here today to share their wisdom and specifically what their healing justice work has looked like in the age of COVID-19. And so rather than reiterate the disparities that we know exist and disproportionately burden Black and Brown folks, we'll devote our time today to talk about the healing strategies that exist despite structural and systemic barriers. We'll focus on how we get to equity by healing ourselves, our communities, and transforming our systems. I will give formal introductions before each individual remarks, but I'm just really want to say that I'm pleased to have Emanuel Brown, Brittini Gray, Venus Evans-Winters, Nkem, Ndefo, and Farzana Khan to join us today. So as I mentioned, this is the second webinar in the series, The Color of COVID, sponsored by the Institute for Healing Justice and Equity. And we developed this series to highlight the voices of experts who are working on the disparities that COVID-19 has laid bare and that were here prior to the pandemic. I should say I am Dr. Kira Hudson-Banks, and I'm proud to be a co-founder along with my colleagues of the Institute for Healing Justice and Equity. So my co-founders, Dr. Keon Gilbert, if you were here for the first part of our series last week, you met him, and Dr. Amber Johnson and Rakaya Yerby. Our program director, Michelle Rolfsmeyer, we want to thank you for all that you've done and navigating all the logistics and setting up the webinar on a tight time schedule. So we do welcome you to become acquainted with the Institute through our various channels that are listed here. So just to give you a sense of how our time together today will be structured, we will have remarks from each panelist and then questions from you. So please do take notes, share your questions in the chat as we're going along or the Q&A function. And then we'll plan to have about 10 minutes at the end of our hour together for questions. All right. So first we'll have remarks from Emanuel Brown. Emanuel is the Chief Innovation Officer at Strategies for Freedom, founder of Transvisible, Black Love Convergence, and The Well. He's also a senior fellow at Pop Culture Collaborative. And I want to kick it off with a question for you, Emanuel. How do you define healing? How have the constraints of COVID-19 shifted your offerings and programs? And in general, here's some remarks from you about your work and healing justice.
Kira, thank you so much for inviting me here and to be among these additional panelists. Just feels so good to see what our people are up to out in the world. So my name is Emanuel Brown, and my pronouns are he and him, and I'm calling to you from what is a manifestation of my own healing, which is Acorn Center for Restoration and Freedom. It is both my home and the future site of a place of restoration for other BIPOC, queer and trans folks who are doing this work. I'm so grateful to be in this space talking about this topic. And I love to ground the conversation of healing justice in what our definition, my definition, my community's definition of healing has become out of practice. I root my work in the Black diaspora as somebody who has both largely Caribbean, but also Northeastern, and getting to learn Southern roots within this country. The diaspora runs through my veins, and the diaspora is where I started my work. And so within our community of practice, and that is really what I think about, I've been building over the last 4 years underneath all of those fancy titles and names, really is just a community of practice, a community of people who are interested and committed to moving towards freedom in a particular way. And from that community of practice, I've been learning, we've been moving with this definition of healing, the process of building awareness of how harm or oppression has impacted you, activating practices to restore your wholeness, and to sustain a place of possibility. I'll read it again. The process of building awareness of how harm or oppression has impacted you, activating practices to restore your wholeness, and sustain a place of possibility. And right there is where my work lives, and the work that we're doing on this side with practitioners and with community lives. I was saying, and I was remarking that about 80% of my work, 70 to 80% of my work was already happening online, right? As somebody who was an independent practitioner, who was starting my own businesses and programs, I was already about 70 to 80% online. But that last 30 to 20% has been crucial and important, right? I don't want to get confused about my personal needs, but also my community needs to gather, to be in person, right? Again, rooting the work in the Black diaspora, it has been important for us to understand what is the importance of gathering, right? In a digital age, we could easily forget that gathering actually is its own healing, being face to face, breast to breast, voice to voice. Black Love Convergence is a great example. Black Love Convergence has been happening for the past 3 years, and it's a gathering of Black folks who really come together to say falling in love with Blackness is an act of freedom. I believe that. I want to be in practice with that with other Black folks. Like, we know for all of the different reasons that oppression provides, we don't necessarily get to do that on the daily. We don't necessarily get to do that in our homes, in our relationships, or at work. And so having that space was really important, to come, to be away, to be on Black-owned land, to feel that. So for me, it's been about reimagining what are the intentions behind gathering together in person, and what of those can we support people with doing where they are, and what are those can we replicate or be creative about inside of this virtual space, right? So one of the first things is I stopped referring to anything as a meeting. I was like, I'm hosting gatherings, I'm hosting kickbacks, hangouts, coffee dates, touch points, like anything else other than a meeting, and really even other than a webinar, because it felt so important that like that language became so important to folks. So with my work, we were able to activate a process and a program called the Well throughout the COVID-19 response. And this program started within the trans and gender nonconform and non-binary community to say, what if we treated healing and spiritual justice work as a first response to oppression? And so we were able to launch within a very short amount of time, activating our network to have 8 wellness rooms that cater to different communities, including the practitioner community. And so for me, I have become very, very clear on how important it is to actually center the practitioner community as we do this work. I think it felt like a simple thing to say, well, now everything is online except for body workers, except for acupuncturists, except for people who do hands-on work, how everything goes online. what did that do to folks who were in the upper age brackets, our 50-plus crew, right, who have been providing services for 25 years, some of them, moving their practice online, for some of them was easy, and for others was almost impossible, right, to think about how do I take the work that I've been doing, sitting with people heart to heart and going online. So for us, it's been a refocusing, and that's always been a focus of my particular work, the practitioner, in thinking about what it means to do the intention of their work in a virtual or in a distance way, right? And what I've noticed in my community of practitioners is, like, for some of them, it's taken, more than 2 weeks to figure that out, right? For some of them, it has been a stretching into other gifts or services or offerings that they might not have been providing for the last 10 years, but they're like, all of a sudden, that tarot reading skill that I had sitting on the side pocket that I would sometimes do is now the thing that I need to actually bring forward.
I really appreciate you opening with that, because I think it bridges beautifully to some of Brittini's work, because you talk about activating networks. So it wasn't like you made up this desire to connect with trans and gender nonconforming folks. Like that was your relationship, your community already. And I think that's really important for people to hear, because I think sometimes when people see disparities, they want to go to a community. But if you don't already have relationship, that can actually cause more harm. Do you have any thoughts or suggestions for folks around that idea of building community in times outside of crisis so that you can activate those networks in moments of crisis?
Absolutely. For everything that I do, I call it building a relational economy, right? So all of my work has come through and from relationships that I have built individually, networks of relationships that people in my community of practices tend to. And so when you think about moving towards response mode, my first thing is, like, who are you in relationship with? And crisis mode isn't always the best time to build a relationship, because it can make the relationship feel very, very transactional. So if you're not already in relationship with trans and gender nonconforming folks, if you're not already in relationship with Black communities, if you're not already in relationships in these places, you might have to think, okay, what is that secondary relationship that I might have that I should be able to tap into to support the deepening of their relationship in this crisis? And that might be my first step into building relationships. I think when we don't move in a relational way, that's where we fall into the trap of tokenization, right? Which we all, I'm sure many of us on this call have experienced, where you're like, oh, I am just the trans face in the room, or I am just that Black face in the room, or whatever POC face in the room, or whatever it is, because it doesn't feel like you're trying to get to know me, understand my people, understand my work, and support me in that before you even ask me for anything, right? Yes. So we were able to activate the well because we have just done the work of building those relationships, so that when the community needed, people were like, yes, I'm ready. Yes, on this day. Yes, 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 yes.
Yes. Yeah. Wonderful. We might have time to dig into that more in the Q&A. The other thing that you mentioned that I think is important is the role of practitioners, of healers, of people doing the work. And that's something that is at core to the work that Brittini does. I want to introduce you formally, Brittini. Brittini Gray has 10 years of professional grassroots organizing experience, over a decade of anti-racism training, and 20 years of artistry, and brings a unique perspective and design approach to the field of racial and social justice. Brittini is the organizing director for the Black Healers Collective and the InPower Institute here in St. Louis. Welcome, Brittini. I'm wondering if you could talk a bit more about the role of healers during the pandemic and your work more broadly.
Thank you. Good afternoon, everyone. I guess I want to locate myself as one who wears many hats. And so I'm going to start with a reflection about organizing as it leads into the role of the healer. So I think right now in our current modes of organizing, we are continuing to service capitalism, refusing to rest, setting unrealistic time frames, reacting to power and political spaces with temporary, tactical, and rush solutions. We are currently lacking strategies that will both protect us and move us towards the freedom that we desire for our community. Therefore, healers must also be politicized in their work. It's not enough for us to just want to work individually, one-to-one with people and address the personal traumas that people have in their lives. This is an opportunity where we must understand that whether our work is calling for stillness or for movement, for rest or reflection, for stability or intentional discomfort, it has to be rooted in an understanding of oppression and its impact on our lived experiences. And that the impact of oppression is precisely the reason that we need to heal. So I think that's important that we take that kind of frame towards our work. This is, again, not to ignore the personal traumas that people have suffered, but it is to say that it is important that we frame our healing in a way that seeks to heal the person's relationship to society, and that collective experiencing calls for collective healing and processing. So then, if that's the case, what is the role of the healer? One who is already rooted in community, as Emanuel has talked about. I think one is to be present to the moment and to affirm the experience of right now. Second, to affirm the wholeness of the people right now. Next is to witness the world as it is, flaws and alls, and call out the contradictions to whatever stands in opposition to our wellness, our wholeness, and our worth. But we also have to be able to model for the people what it looks like to rest, what it looks like to heal, even in the midst. Because if we don't show, they won't know. We also have to be able to hold space for the people, which is requiring us to develop new strategies for engagement, as Emanuel has also uplifted. But most importantly, I think that we have to be absolutely intentional about how we love, honor, and respect the people in the face of all that is in front of us. And then finally, to actually cast the vision for the next 400 years to come. And this is where I think the role of the healer, the role of the preacher, or whatever your spiritual care provider is, and the role of the organizer all need to come together, because this is the opportunity for us to shape what is to come versus what is now. I think for us to be present to the now is to be present to the grief and the loss that is happening across the world, to be present to the dangers that shelter in place and stay home orders have presented for some of the most vulnerable in society. It is to be present to the ways in which how we categorize essential needs reflect our inessential view of those people. We have to also be present to the invitation to slow down, to be present to the ways that community is showing up for each other, and to be present in the ways that Mother Earth is being able to restore herself. To be present is to sit with all the opportunities of the moment and all the mourning that this moment also calls for. I got a lot more thoughts, but I think I'm gonna stop there for now.
I appreciate you sharing your thoughts, and it's making me think about the piece around impact of society, and how as practitioners in moments where, like right now in terms of COVID, we were aware of how oppression has harmed individuals. And so it's a tenuous time because folks are in the midst of crisis. And yet we understand that, like you said, we need to see them in their individual wholeness. Yet there are these larger systems that we know are operating that don't see their wholeness, that don't acknowledge their wholeness, and are exacerbating the disparities. And so I'm wondering, as you look at either the offerings that you see happening now or that should be happening, how do we balance the care for individuals and the basic needs, like you mentioned, and the larger dynamics? It's kind of like Freire's kind of praxis action. How do you help people see the system, but then also act within their system? But they're in the midst of sometimes trauma and can't be expected to act.
Right. Yeah, I think this pandemic calls for a lot for the healer to do. And so you do have to be attentive to the needs of the people, but you also have to look for those opportunities. So for example, right now I'm in the midst of a meditation series, which was originally 6 weeks. I've extended it to be 10 weeks. But it's meditating through grief and anxiety. I originally started that series only focused on grief, primarily because I was trying to process my own grief. And then as we hit pandemic, I realized that we need to also address anxiety in that space. Anyhow, there was someone who was just reflecting on their feeling of powerlessness. And the first time they said it, I didn't respond to it. But the second time it came around, I saw it as an opportunity because most of us are feeling powerless under these conditions. But how do we reframe our experience to say, I may not actually be able to change whether or not people are dying, but I do have power and agency in being able to decide how I respond. I still have agency to determine what I do with my life and how I choose to organize, whether I choose to rest or to retreat. And so it may be smaller ways that we have to regain and focus on our power, but we have to use those opportunities to reshape the conversation for people as we are in the midst of the healing.
There are connections that I didn't even envision, because next we'll hear from Dr. Venus Evans-Winters, but as we get to the work of Nkem and Ndefo and Farzana Khan, it's this idea of thinking about how do you see the opportunities, like you said, the individual healing that we might be able to help people, but then like the larger, the ways in which our networks can allow for a larger impact of our work. So I'm foreshadowing. Let me just keep it moving, and let's hear from Dr. Venus Evans-Winters. Dr. Venus Evans-Winters is a scholar in the field of social and cultural foundations of education, Black feminist thought, critical race theory, educational policy, and qualitative inquiry. She's also a licensed clinical social worker, certified clinical trauma professional, a licensed school social worker, and a youth advocate with experience serving in South Africa and West Africa. And so I'm wondering if you can share with us how you've seen the stress and trauma of COVID-19 exacerbating the disparities. How is it showing up in your work with clients and in the community?
Thank you for that question. I would like to actually piggyback off of Emanuel and Brittini, because some of the issues that they are talking about tends to affect the people who are least likely to have access to health insurance or high quality, culturally responsive mental health professionals. So as Brittini has mentioned, one of the problems that we confront, I think as Black people, people of the African diaspora, and people of color, is that it is very difficult for us to access services or to find clinical health professionals who understand us, understand who we are. And what I mean by that is a lot of people, Dr. Banks, don't understand the relationship between healing and something as simple as language. Also, which Emanuel hinted at, many times a mental health professional, a spiritual leader, or a healer also has a limited knowledge of the historical context of trauma, right? So for example, I like to reframe pandemic. Because if you look historically, especially within the United States context, but the global North overall, African people and other people of color, especially people from colonized backgrounds, that we have at least 400, 500 years of pandemic states. And so what I mean by that, if you look at the World Health Organization's definition, and it's a shared definition, even with the Center for Disease Control, the CDC, you will find that a pandemic is basically a disease such as a virus or other conditions that have spread across continents or geographical locations. And so if we look historically at Black people in the United States, also there's more data coming in on Native Americans or indigenous people here in the US, we find that we have been inflicted with all kinds of viruses and disease since contact with Europeans, including people are always talking about now the Spanish flu, but we can talk about tuberculosis, we can talk about syphilis, yellow fever, malaria, etc., conditions that was inflicted on us when we had contact with the colonizers. Now, keep in mind, though, according to the World Health Organization, they get to decide, right, a set of nations or leaders, what is a pandemic. So technically, here in the United States, African Americans and Africans and people of color have actually been in a state of pandemic for at least 400 or 500 years. It just wasn't inflicting those with power. So yet here we are again. And so what I like to talk about from a mental health perspective is actually that people who are more vulnerable to pandemics are vulnerable people, right? So when we're talking about health and healing, we also have to talk about how we got to this state, right? So we have to talk about vulnerability. If we're going to destigmatize mental health, and we also have to advocate for mental health justice, to borrow from Emanuel's words, then we have to talk about Black people are vulnerable and other people of color are more vulnerable to pandemics. Second, we have to talk about resilience. So if you look at African Americans within the context of the United States, for at least 400, 500 years, we have been resilient to pandemics and other diseases and viruses such as COVID-19, HIV and AIDS, syphilis, etc. But what we rarely talk about is our strategies for coping, right? And so now I think, as Brittini pointed out, we need to start talking about also opportunities, right? So a part of healing is talking about the opportunities to change things. Just imagine in communities of color if we just destigmatized mental health. If we destigmatized mental health, if we named what was hurting us, what was harming us, and how our pain looked and how we coped with it. And so once collectively, as we address this, we began to see that some people are more vulnerable to a pandemic because some people, some populations, some communities, some cultural groups are simply more vulnerable to chronic stress and trauma. So my biggest concern, to respond to the question directly, is that our government needs to provide more resources, but of course, in order to provide more resources, we have to admit that some people have inherited chronic stress and trauma. So stress itself is not going to be debilitating. It's long-term stress, and it's trauma that happens repeatedly. So as you can imagine, it's with indigenous people, colonized people, and people of African ancestry in this country for 400 to 500 years, we have been attacked over and over and over again. So that makes us more resilient. So the next step, which I'm glad to hear, Emanuel, our people on the ground actually talking about, in Brittini, I'm glad to hear now we're talking about resistance strategy. So the main step is resistance, and community mental health providers, activists, scholars, we can participate in that healing process from all three fronts.
And what do you see as, in terms of the opportunities, you mentioned the stigma. How can folks who want to break down that stigma? Because I do see opportunities. I've seen whether it's hotlines or funds that are giving people access to services, and you hope that those are folks who have some cultural competence that are giving the services. But what do you see as the opportunities for folks to potentially work on destigmatizing help-seeking behaviors?
I think one opportunity is actually social media. So Emanuel hinted at that's one of the programs that he's been providing and his network has been providing. And as you know, I spend a lot more time on social media. In fact, some scholars would say I, or even you, Dr. Banks, we spend too much time on social media. But I think that you and I saw in your opening slide, we could appreciate that we go to where the people are. Because, and I know I've worked with Brittini before, I'm a student of hers, and something that we both knew, as younger scholars, that academia is very segregating and has a limited view of the world outside of academia. And so sometimes we have to go into those spaces. And I do think that social media, as well as, other opportunities to network and to work with community organizations helps. As far as social media, it might be something as simple as the webinar that your institute is providing right now. Sometimes it might be a tweet, right? So I follow some of you all online. I see Dr. Banks, for example, you have more of a holistic approach to health and wellness. So you talk about your family, you talk about your research around, color and racial identity, right? Health and healing. You also talk about your work as a psychologist. You share with us some of your workout plans. I've had the privilege of following Brittini for nearly 10, 15 years. She speaks about her ups and downs, everything with emotions, mental health, friendships, families, and that level of, and she's beautiful, so of course she's inviting. So that level of transparency, that level of vulnerability is another strategy for us to destigmatize mental health as well as mental illness. Because I think sometimes, especially for Black women, I'll speak specifically about Black women here, we have it's a struggle for us to find balance. So on the one hand, I hear young people, because I work with a lot of young women of color, and they would say something like, I'm bipolar, I'm off the chain, I'm on 100, I go from 0 to 100. Well, now we might be talking about an actual mental condition. So we want to embrace it, but we may not want to heal from it, right, Emanuel and Brittini, right? So we may not want to heal from it. But on the other end, when we're talking about mental health, sometimes we are actually stigmatizing that too, or over-reliant on that concept, because now we don't know when to rest. One of my biggest disappointments as a practitioner, as an educator, as a mother, as a sister, friend, a healer, is opening up social media, whether that was Instagram or Twitter or Facebook, and we had one more person telling people what they should be doing during a pandemic. Yet they wasn't telling them to rest. They was telling them, go exercise for an hour, keep yourself strong and healthy. They were saying, clean up your whole house, and just get it done. Go write that book. And I thought, wow. What people don't understand is that people who are survivors of chronic stress and trauma, sometimes they can't sit still in their own bodies. And that's why some of us practice meditation and other groundedness practices, right? Well, sometimes that's important to take pause.
Yeah, and you bring up an important point, which is another beautiful bridge to the work of Nkem and Ndefo. Something that I learned from Nkem is this idea that you talked about some people saying, oh, you should be doing this or you shouldn't be doing that. And I think what I learned from my work with Nkem is that it's really important to honor people's wisdom around their own bodies and their own states, and not give primacy to one state in particular, to know that we have inherent wisdom, and that we can learn to observe ourselves and learn that we have resilience in us. So let me formally introduce Nkem and Ndefo. She's the founder and president of Lumos Transforms and creator of the Resilience Toolkit, a model that promotes embodied self-awareness and self-regulation in an ecologically sensitive framework and social justice context. Licensed as a nurse midwife, Nkem also has extensive postgraduate training in complementary health modalities and emotional therapies. She brings an abundance of experience as a clinician, educator, consultant, and community strategist to innovative programs that address stress and trauma and build resilience for individuals, organizations, and communities across sectors, both in her home country, here in the United States, and internationally. And so I think, Nkem, if you can share with us some of your work, because I think that there's some really beautiful ways in which you have used COVID-19 as an opportunity to build on the work that you've done around resilience, the offerings that you have, and what you specifically want us to know about how Black and Brown folks are faring during this tumultuous time.
Thank you. It's really actually an honor to be here with all of you and just listen to the great work, like be in that energy. I appreciate it. Thank you all. I have lots of thoughts. So these are going to come out in some kind of connection because they're all coming from somewhere inside of me. I think that, through time of my own experience personally and working with folks, vulnerable folks of all kinds, people who are marginalized, actively on the receiving end of all kinds of violence. And this idea of working with people, when you actually even use the word trauma, they push it away. Like, that's not me. And it's like, you can try to put someone, like, it is trauma. And we say, look at the definition, you're in trauma. And we put it in people's face. And they're telling us something. They're telling us something that it's too much to bear. People are too busy trying to survive. There is not enough spaciousness around people to even entertain, I am in trauma, right? To even have even self-reflective space. And so, all the multiple and compounding and intersecting oppressions, right? Economic, racially based on every identity. And that lesson is, well, then where do we start? Because if we look at sort of traditional psychotherapy as very talk-based and story-based, but in a way that it's devoid and disconnected from the body, from history, from anything resembling any culture other than, white Western European culture. But we look at the burgeoning of somatic, right? These somatic new trauma therapies, and they're very much situated in trauma in the past. Let us help you resolve trauma in the past. And I'm like, wait a second, like, people don't have this space. Like, how do we work on the ground when you're, and so the lessons that I learned in doing this, because my best teachers are showing me like what's working and what's not, what worked for me, what worked for them, is this idea that we need to, of stabilizing and resourcing folks. Like, how do we stabilize and resource folks, which helps them create space both internally, right? For reflection, for rest, because you can tell someone to rest. You're pushing against survival instincts, right? It doesn't work. People don't even know how to rest. People don't even know what comfort is. There's not enough spaciousness around this. So here we have people who, our folks have endured so much. This is familiar in some ways. It just ratcheted up a notch, right? We're the first ones to go, right? It's like a horror movie. Have the black person, the brown person go out and see what's out there and who gets killed first. So it's kind of like we're used to it, right? But then we're cooped up either inside or we're out responding in high alert, right? Either whatever kind of essential work that you're doing, right? And then you're telling us to rest. It's like I'm revving and I don't know what to do with it. And so how do we stabilize? How do we resource? How do we settle folks? Just enough to make enough spaciousness that we can like some light enters. We can think of new, different ways. And they're not huge, but there's something. And then we can settle a little bit more and then it opens again. And so this is the approach I've taken. And I think about, like, today, I am working and launching a large program for a healthcare worker union here in California that has 100,000 members, or just shy. And this is nurses, this is nursing assistants. These are the people who are cleaning hospitals and clinics. These are the people who are serving food, overwhelmingly people of color. And in California, hugely immigrant, right? And so here are the people who are at the receiving end again and the first to go out, right? With inadequate protective equipment, also then coming home to overcrowded housing and having to homeschool their children. And how do we resource and stabilize them in the middle of this? And so this work came out of work that I had done with this particular union with their organizers, because first, starting with how do we stabilize and resource the organizers? Because they are, and then it was to the leadership, the union leadership, and then it was to the union stewards, and then it is to rank and file. And so it's the same way, like in a family, you stabilize the parent, right? And you stabilize the parent, they can hold the children more easily. And so I had to think of what are new ways that we can scale this rapidly and virtually. People can't gather, right? Which is, again, a big wound. Thank you, Emanuel, for really calling that out about how much I'm missing it. I'm trying to keep pushing it to the side, but I'm really, really feeling it. How do we do this with a combination of, and people working all different shifts, of modular videos, as well as what are the ways we can engage using social media, using Facebook Lives, using Zooms, using different ways to interact. And we're trying and experimenting. But this wouldn't happen, as you said, with, all of you have said, it's the rooting in community. I couldn't just like run out and say hey, I have this offering. It was based on a track record and working with people and us organically. And it's the idea of, and what they've said there is that it's not just here's some breathing or here's some meditation or here's something, but that it's framed in a language we understand, that it validates our experience, that so often we say, you shouldn't be stressed, no, actually you should be very stressed.
There's a lot to be stressed about.
Right, but can you recognize the moment when it's okay to rest?
Yes.
Can we recognize that? And so that's a big piece that I've been working at, is like teaching us how to spot those moments of relative safety and let it down so we can pick up and keep going. So I'm going to leave it there to leave room for Farzana and questions.
Yes, I appreciate that. Let's connect to that work and thinking about. I thought we would start kind of local. We have someone from St. Louis and folks from around the United States, and then Farzana in the UK, like to give us that perspective from there. To formally introduce you, Farzana. Farzana is the executive director and co-founder of Healing Justice London, which is committed to creating heart-centered spaces, tools and resources of healing for Black, Brown, working class, LGBTQI communities to undo harms, repair vision, and sustain futures possible free from intimate, interpersonal, and structural violence. Farzana, welcome. Thank you for being with us. I'm wondering if you will share some of what you're seeing in the UK in the organizing that you've been doing. What structural changes are you seeing that we're in the most need of? How have you seen Black and Brown folks disproportionately impacted in the UK?
Firstly, I really want to say thank you for extending this invitation to me, and I'm so full from everything that everyone has shared, and there's just so much. So I really, really want to come from that space of gratitude. And I've just made some notes. So if I do look down, it's because my notes are in my hand. And yeah, I want to kind of springboard from what Nkem had said around the kind of stabilizing and resourcing. And one of the phrases that we use at Healing Justice is creating capacity for transformation. And so that work of capacity building is like the thing that I'm finding central in all the different spaces that currently, I guess, I'm trying to support or in solidarity with, and Healing Justice London is also in solidarity and trying to support. So really thinking about what capacity looks like based on context, reality, and our histories. And so, yeah, just bringing that in and holding that alongside Nkem's really valuable contribution. I think what's really interesting is that today we had a government meeting, the normal kind of briefs that they do, and our Prime Minister didn't turn up to the meeting. But what is also quite sad about today is that it's the highest number of deaths in the UK across Europe. And why that is particularly shocking is that we have a public health system in contrast to the US. And so I feel like this conversation is very connected because of the way in which the UK, particularly the government that we have in power right now, has moved towards a US-centric model of health, but also has participated in, the medical industrial complex in terms of relationships to privatization of data, in terms of its relationship to pharmaceuticals. So, and part of Brexit, where people knew that our public health system, the NHS, would be on the table people still chose that, you know, as a nation. And so I think that there is something really telling about our relationship between the US and the UK alongside that, and particularly today. And I think one of the things, before I touch on kind of efforts, that I'd also like to bring out is that the NHS, though I am for it, I love it, the public health system that we have, and I believe in public health, is not neutral. Like when we think about who the public is in the context of the UK and the US, it's still the white dominant identity, it's the able-bodied, it's the male. And so the conversation around public health, that I think I want to try and steer some of this conversation, some of the learnings, because I think that that's important for all of us that are doing public health work, whether we're healers or community activists or academics, is also looking at the eugenics side of where so much of what our understanding or common sense around health is still rooted in, and how much there's work to be done when we look at the disproportionate deaths in the UK of Black and brown bodies, but also as health practitioners, and I understand that to be the same in the US, is the relationship to eugenics and which bodies are disposable and which bodies can be positioned at the front line and bear the brunt of it, and all the things that everyone else has also touched on in terms of the compounding of oppression and trauma. So I wanted to kind of bring that in as a context. And then in terms of areas that I'm Healing Justice or myself are working in, or strategies, the first thing that I want to say is that if you Google me and mutual aid, you'll find an article. But what I want to give context to, and I think it's appropriate, is I have been part of mutual aid efforts in the UK, and in the UK, the first few days, there was a widespread effort across the UK with thousands of mutual aid, local ones, setting up. But what happened was that those spaces got taken up by the dominant identities, white bodies, and we saw the reproduction of harm. So calling the police on families, all of those things starting up. And so as a result, I'm now part of a liberation team that is trying to build resources nationwide to also interrupt those kind of reproduction of harm in mutual aid. Because unlike mutual aid in the UK is still, you know, a relatively new concept, is in very specific mental health and very specific people of color, queer people of color spaces, but wasn't a mainstream kind of framework. And so people aren't really as familiar with how to connect that mutual aid was actually emerging as a de-escalation strategy, especially for those that experience emotional distress. And so the approach to call the police for people who are experiencing emotional distress is the opposite of what mutual aid is about, and how it was there to create an ecology and there to create a support system beyond the state. And so there's still a work around that to be done, and like really build that into mainstream spaces. In terms of Healing Justice London, straight away we did things that other folks have done. Nkem and Brittini have mentioned, and Emanuel, in terms of like community support, the gatherings, the meditations, and also trying to build long-term strategies. So we had a body of work prior to this on loss and bereavement, specifically for people of color, because of the ways that our communities experience isolated forms of loss and bereavement and interconnected forms of loss and bereavement. And so, sorry, Brittini, sorry. And so we realized that this is a framework that needs to be rolled out. And so we're really working on trying to think about loss and bereavement, but also in the context of our histories where loss and bereavement has been a part of our lives, and also what rituals are available for us to revive or work with as part of that process. Two other quick things that I want to touch on is economic justice. So really thinking about, you know, we have the state, which has been absent or not providing an adequate response. And then we've had disproportionately Black and brown and working class and other marginalized communities not be able to access public funding, or we had a statistic from Belle which said 9 out of 10 Black and brown community groups or organizations would not survive the next 3 months. And so as a result of that, pre-COVID, but catalyzed by COVID, a group of us, all Black and Brown, came together and have formed a coalition which goes live tomorrow, which will release a first wave of 500,000 to Black and Brown and anti-racist work. And so that goes live tomorrow, and it's called Resourcing Racial Justice, and making a note to hold the philanthropy and foundation sector to account, which is having very mediocre responses to the way that Black and Brown communities are being impacted, and that this is a racialized issue, and none of them are actually explicitly talking about white supremacy and whiteness, and also naming who should be the recipient, but in the same way how we level those power dynamics, so it moves into equity and economic justice, and not about maintaining the funder and the philanthropists. So yeah, I guess those are a few examples of efforts that are existing. I know you also had a question around systemic responses. Do we still have time for that, or?
Not at this moment. I want to see if folks have questions. I want to open that up for folks to have questions in the chat, and then the panelists, actually, you all have been sharing some questions for each other that you want to loop back to. So if we have time, we'll come back to that. So I want to see if folks have questions. Attendees, feel free to put your questions in the chat or the Q&A. And then something that a couple panelists mentioned is, let me say this one piece though. Farzana, you mentioned creating capacity for transformation. And I think that that's really key for folks who are listening to think about, is where can you support that creation of capacity for transformation? It might be that you're in relationship and are able to do that directly with the community. It might be that you're not, and that you do it by sharing resources or space or other sorts of ways that you can see folks who are doing the healing justice work and doing it in community and support their efforts. So I wanted to just lift that up. So a couple people asked about practices for grief and rage, and the way in which grief and rage in Black and Brown folks, sometimes we experience depression and anxiety in a very agitated state that looks like anger. And so wanted to hear folks on the panel, if anyone had specific practices that you've seen that support people through their grief and rage.
And also, just to offer a little clarity about the term rage, for me, has been really important. And I think when I talk about rage, I talk about righteous anger, right? Like talking about, you know, tapping into the global impact, right, that we're seeing with those people who are already vulnerable. Tapping into what some of the things that Farzana just uplifted about, like, oh, mutual aid except only for white people, right? like that kind of in my own personal practice that I've experienced as like almost 10% mine and 90% collective unconscious, right? Like where it's like, oh, I'm tapping into the deep injustice that is being put in this moment, not just angry outbursts or that experience. So just to add some context, because I know rage could mean a lot of things to a lot of people, and those are the practices that I'm really speaking to and thinking of, and hoping that we can continue to share.
And yes, thank you for clarifying that, Emanuel. I think I do, yeah, because it's interesting that when I hear you, talk about rage, I'm thinking about I think it's used in the same way that I talk about resistance as a part of the healing process. So something more organized, something more strategic, and often planned, right? But I do want to respond to the question, because I do work with the criminal justice system. I do work with often the court system. And so some of the work that I do is working to protect the rights of mothers, mothers of color and poor mothers mostly. I guess, mothers of color and poor mothers. And so right now, one of the biggest fights that we do have, of course, is around issues of protecting Black people and other people of color, especially poor people's right to parent in this country. And we've been having that struggle since the times of enslavement. But I also work closely with girls of color, Black girls, gender non-conforming and non-binary youth too, who have been criminalized by the school system. And I think that we do have mostly adults, but everyday people who actually mischaracterize Black girls and girls of colors, or people who have been previously traumatized, symptoms and expressions of anger and depression, right? So they may see anxiety or depression present as anger. That's not necessarily the case. So in most times, what is actually a depressive symptom or an anxiety symptom is read as insubordination and or anger. Okay, so that's one thing. But two, I mean, anger is a real justifiable symptom of stress and trauma. And as a lot of people around the table know, or around the video know, the body keeps the score. So what that means, some people are more sensitive to their environment, and so they are more likely to have reactions to irritability and frustration. And that was something that I even had to learn, you know. So something that I even teach my clients is, if you got that cousin or that girl, as soon as somebody, you know, step on their white Nikes at the club and they ready to fight, you know, she may want to talk to somebody about where that comes from. So I don't want to get too much into the science of how anger presents for someone who has experienced, again, chronic stress and repeated trauma. But some healing modalities that we know work, and I'll give everybody, I see we got like 90 folks in the chat or around on the call or in the webinar, I'll give some quick healing techniques. One, meditation. So you can, I think it was Brittini or Nkem that talked about meditation. I do recommend that you actually partner with someone who is certified or highly skilled and trained in meditation for treating trauma survivors. I know we got a lot of, you know, lay persons who are doing meditation right now, but you should work with a trained or highly skilled professional. Meditation. Another one is storytelling. It's very important to participate in storytelling, and that can be storytelling of your family's history or even some type of made-up story, a fictional story. 3, theater. In fact, I just gave a homework assignment to a client. Theater is drama is very, very important to healing from trauma. That's another good technique. So acting, performing roles, coming out of the body, and also martial arts has been shown to help. So any type of, and that can be martial, I don't know, they do say martial arts because they're studies, but that can also be any type of rigorous exercise to help heal trauma. Okay. Yeah, I'll just use those lists, but those something specific that you can try at home.
And Nkem?
I think also just an understanding, like I think of grief, it's like bunnies, like they get together, like all of your griefs, regardless of where they came from, they're like bunnies, they get together and suddenly you have all these bunnies everywhere, they're reproducing. And so recognizing that, you know, there are interpersonal griefs, you know, that have happened in our lifetime between people, between the people we love, the loss of all kind, you know, loss of people, loss of all different kinds of things, right? And then the larger structural grief, and they are having babies together. And when we use a traditional psychotherapeutic approach, they put all grief into the psychotherapeutic bucket when the structural grief, as Farzana was speaking of, is not amenable. You don't fix the grief around, and the anger that pours out from that, the righteous anger, as Emanuel called, from racism, it's not fixed in the context of psychotherapy. It's fixed in the context of, it's addressed in the context of movement, right? Movement building. So that the healing is multifaceted. There's what's happening. There are many ways to heal because the grief is multifaceted. And so there is the body-based learning to be present with distress, learning to make spaciousness, to sit with what is there. And so many techniques to learn to sit with and to sit accompanied by, and then to be in action, in movement, in expression and art making, and then also to be moving the systems that created harm in the first place. So it's all of those. And this moment in particular, COVID, there's so much grief, loss of life, loss of livelihood, loss of ways of being, everything is up in the air. Loss of security. It's like playing the grief piano,
And Kim, I thought you might be also wanting to refer folks to the Resilience Toolkit. If folks want to go to Lumos Transforms, there's a beautiful Resilience Toolkit that Nkem's organization has put forward that that is a tool and a strategy that's available to folks. I saw Brittini wanted to make a comment, and then we will move to close.
Yeah, can y'all hear me okay? Because my computer moving real slow. Okay, all right. So, yes, to everything that was just stated, I wanted to say that I think practically, I'm actually, I've been doing a lot of reflection around grief for the past year, and I'm actually in the camp to believe that we need more public grieving, which is even more difficult during this opportunity. And so I know most of us have screen fatigue, but this is definitely an opportunity to use opportunities to gather virtually still, to coordinate opportunities to mourn and to grieve. So even if you can't be physically together, if you're talking with people across the US, y'all find a time that works Central, Eastern, and Pacific to all do something together that commemorates whatever that loss is that you're grieving. But grief demands to be discharged. Once it is processed, it wants to leave. And so we have to be able to open ourselves up to the opportunities to release, whether that's screaming, crying, laughing, whatever our form of discharge may be, we have to honor that. So that's it.
Yeah, I wish we had more time. There's so much wisdom on the call, and for us to continue to have a conversation with each other, perhaps we should have a part 2. I think that what we have done is help people frame what healing justice is, and the related concepts. So not just what healing justice is, but what it means to be in relationship. That's a lot of what I heard, the importance of creating this capacity for transformation and what that looks like, whether it's through the work of mutual aid, whether it's through individual one-on-one work, collective work, the practices that we do in community with each other or in our homes, in our own lives. And someone asked in the Q&A, if you had to sum up the main point of this presentation, what would it be? And I really feel like it's important for us to realize that healing in crisis involves seeing the system and the ways that it has exacerbated stress and trauma, and that we must attend to people in context and in relationship. So I want to say thank you to the panelists for sharing your time and expertise, and to the attendees. We really appreciate you joining us today. If you weren't able to attend the first part of this series, which was around strategies to stop the trend and the disproportionality of COVID and its impact on Black and Brown folks, you can find the link on our website. And we want you to be on the lookout for other webinars and resources coming out from the Institute for Healing Justice and Equity. Thank you all for joining us.